Thank you very much for your inquiry about tummy tucks. I love doing tummy tucks because it really transforms how a woman or man looks. So the first question is, who would benefit from a tummy tuck? There's really 2 to 3 situations. One is somebody with a lot of loose skin. You can exercise as much as you want, do 1,000,000 sit-ups, lose all that fat, but no matter what you do, you can't make your skin tighten up. You can get a little bit of tightening from things like Smart Lipo, which I'm a huge fan of. But if you have significant skin redundancy, especially women who've had children get that, or a man that's lost a lot of weight, or a woman that's lost a lot of weight, you can't do anything but that skin hanging over your belt line. So the only way to do that is to excise it, which is going to be part of a tummy tuck. The other kind of person that will have a tummy tuck is somebody who has essentially a roll and they want the roll removed. And the third one is a little less common. Somebody doesn't have too much fat, but they have kind of a bowed out stomach. And they might have good stomach muscles, but again, especially women who've had children, or especially twins, they may be a perfect body weight, but when they stand up, their stomach sticks out, and of course they don't like it because it makes them look fat. So there's 2 aspects of a tummy tuck. What's involved is a low incision, usually just above the pubic hair, utilizing the C-section scar, but it'll extend much further. I then lift up the skin and fat almost up to where the rib cage starts. I tighten the muscles. I'm not cutting the muscle. Nobody cuts the muscles, but I have so many patients come to me and ask me if I cut the muscles. The muscles are not cut. What I'm doing is tightening the fascia. Fascia is like the thin layer of shoe leather that's over our muscles, and it keeps our stomach flat. And the analogy I like to give my women and men is it's like a new leather suitcase. If women have had children, that leather suitcase, it's like you stuffed it full of clothes for 9 months. You take the clothes out, most of the time that leather suitcase doesn't look good as new. Every once in a while you get lucky, just like there's some women who have multiple kids, they look perfect, but they're definitely the exception, not the rule. So with the tummy tuck, I tighten the muscles up, and that'll give them give you a tight feeling after the surgery. Then I like to bend the back of the bed about 40 or 45 degrees. As almost everybody knows, if you're half sitting up, you can grab a lot more loose skin and fat around your waistline than if you're standing up straight. That, by the way, is why models, when they have their pictures taken, are always standing up straight. They don't bend over. So I put the back of the bed up 45 degrees, and then I give the skin a good stretch, and I take off as much skin and fat as I safely can. I always weigh, because people always want to know how much skin and fat I took off. And then after weighing it, we discard it. I then sew them up internally and externally. There's no dissolving sutures, it's all internal sutures. People always ask me, do I get a new belly button? No, you don't get a new belly button. You get your same belly button. Think of your belly button as like a button on your shirt. I cut around the button, it slips underneath the skin and fat, it just stays there, and then as the skin gets moved, it needs a new opening. So it's your old belly button, but it just pops out in a different part of the skin, and it's sewn up again with dissolving sutures, and usually the scar is very inconspicuous around the belly button. Most patients, I'll do some liposuction of the love handles or flank area while they're having their tummy tuck, but not everybody needs it, so that again will be individualized. Everybody goes home after their tummy tuck. Most patients will go back to work in about 10 to 14 days. 10 days is a good average, but you know, everybody's a little different. My office manager had her tummy tuck with me many years ago, and she came back to work in 6 days and then worked 12 hours every day. So I certainly had patients who are strongly motivated who go back to work sooner. I want you up walking right away. And I always tell my patients, walk straight, don't walk bent over, don't listen to somebody else for advice, you'll feel much better. I let all of my patients shower the very next day. They'll say, it'll get wet, getting wet will not hurt it. When they're in bed, they'll feel more comfortable with 3 to 5 pillows behind their head and 1 pillow behind their knees. They can lie on their side, because most women don't like to lie completely straight on their back. Follow up, I'll follow you quite closely for the next 2 weeks, and then I spread the visits out more and more. It's a great operation, and it's very transformative. The biggest objection I hear is people say you get a scar. You absolutely have to have a scar, but the scar fades very, very nicely with people. It just takes time, and also it's usually quite low, so not too many people will see your scar.